All right, we are here together to for you to present your work within the European Sexual Medicine Network on one of the subgroups, sexual harassment in academia. I'm very curious to find out about more, out about that, and I want to ask you first to present yourself.
Thank you very much. My name is Lotta Lövgren. I'm a professor in sexology at Malmö University, Sweden. And I'm both a working group leader of the COST, European Sexual Medicine Network, on interdisciplinary research. And we have currently 11 subgroups. And this is one of the subgroups. And I'm a subgroup leader too.
Thank you.
My name is Irma Jakic. I'm a master's student at the University of Zagreb, and I'm finishing sociology.
My name is Melina Westermann, and I'm a master's student of the University of Wuppertal. And I started this project as a sociology bachelor student, and now I'm a Master of Education student.
Hi, my name is Wiebke Schoon. I'm a doctoral student, researcher, and psychologist at the University Clinic of Hamburg-Eppendorf.
I'm Cynthia Tuppershaw, and I'm a volunteer researcher at KU Leuven.
I'm Hanneke Graaf. I'm a senior researcher and program manager at Rutgers in the Netherlands, which is a center of expertise on sexual and reproductive health.
My name is My Lilja. I am associate professor in criminology at the Department of Criminology, Malmö University.
And I am Mika Hagelid. I am a senior lecturer also at the Department of Criminology here at Malmö University.
Thank you. I understand you have some 3 articles planned. Can you tell me a little bit more about it?
Yes, and first I would like to add that we're even more persons within this group. As you can see, it's an interdisciplinary group with people from different academic levels. So we are lacking today 3 more senior researchers. So it's a big, vital, vibrating group.
Nice to hear about it. What is the study exactly that you undertook?
So the aim of this subgroup is actually to explore European students and doctoral students' experiences and reflections on sexual harassment within academia. It's a qualitative research study, so we are conducting interviews and focus groups interviews. And in this way, I would say it's quite high quality of the interviews, because we have so many interviews and so many focus groups interviews, and that's quite unusual.
Over many countries,
over many countries, yes. So from these data, we have chosen 3 themes for now. Maybe we would do even more themes or more articles, but for now we have 3 articles ongoing, almost finalized.
What about the first article? What is it?
So I will give the word to Mika Hagelid about the first article on the concepts.
Yeah, the first article is about how we started out with a broad topic of how people define and conceptualize sexual harassment in academia, chose to narrow down on the obstacles that students and doctoral students face when they encounter cases of sexual harassment. Like what prevents them from understanding that it's sexual harassment, and also consecutively to react to, intervene, or report it at a later stage.
And the second article?
And the second article is on arenas, and me, Lilja, you can tell them more about that.
Yeah, the second article is about students' perceptions of actors and arenas in Sweden and Germany. So in this article, we focus on 2 countries, Germany and Sweden, and how students understand the different arenas, which actors they recognize or reflect on, and the context of sexual harassment in academia. So, for example, we found different gender dynamics of the actors, or one of the theme was about gender dynamics of the actors. We also found that several students talked about the power and the hierarchy at university. And also, we also found that certain arenas within the academy are perceived as more safe than others.
Like what, for instance, is more perceived more or less safe?
For example, on campus is perceived as more safe than other arenas outside campus. Would you like to add something here? There are two more persons involved in this study. You'd like to say something here?
Yeah, so it seems for the expectation of safety for the different arenas, it seems to be interesting that when there are witnesses, it's perceived to be more safe. So when there are other people around, it seems to be more safe. But then on the other hand, if there can be physical closeness, like for example, student parties, it might be more unsafe. But in general, if there are other people, it seems to be more safe than if there's no one around. And then if it's a more formal setting, like in a seminar room or like in a larger room on campus, it also seems to be perceived as more safe, for example.
Is there anything you could add to the story of the second study, or maybe also the first?
Well, we can just continue to the third article on,
Yes.
On the prevention, and Irma Jakic will say something.
Yeah, I think the third article on prevention kind of connects the first two articles. First, we have to know more about concepts, or actually how people define sexual harassment, how students define it. Then we need to know from the Arenas article what are some of the places where sexual harassment in academia occurs. And then, as I said, the third article kind of connects the whole story and explains in what ways the students think that sexual harassment in academia could be prevented, what are some of the practices that they suggest, but also, of course, how to support the victims of sexual harassment in academia. So that's kind of, we get kind of the whole story with these three articles. But of course, as Lotta said, there's also a lot of the space to research some new things.
And then what are, for instance, suggestions that students give for prevention?
Well, the main suggestions are based on educating, meaning students want to be educated on sexual harassment, on how to define it, how to recognize it, who to report it to, for example. They also reflect on different support systems, to call it that way, for example, from peers to family and friends to institutions, meaning like the police or even the institution that they are studying at. So basically, the whole story is kind of focused on educating to prevent.
And how many participants are included up till now?
Until now, in the prevention study, we have 17 people from the Croatian sample, 9 people from the Belgian sample, 12 undergraduate and graduate students from Sweden, and Mika will help me with the number from focus groups.
It's another 18.
18. Okay.
Yeah.
So
that's huge for a qualitative study. So there's a lot of material there, I would say. And the Arenas and the definition concept study had other samples.
Yeah. In the concepts, we are actually a few different, in most countries in that publication. We have data from both Belgium, Croatia, Germany, Netherlands, and Sweden. The total number of participants is 85 for that one. So it's really big. And perhaps I should also say something about the obstacles that they find, because I didn't get to the results. But some of the obstacles that they face is like, firstly, it's the difference between, like, they have preconceived notions about what sexual harassment is and how it should look like. And in reality, that doesn't necessarily concur with those preconceived notions. There is a strong idea that sexual harassment is conducted by faculty against students. And while that is sometimes the case, there are also a lot of cases of between student harassment that diverges from that preconceived notion and faces a problem. Another big problem that we identified there was also navigating blurred and like ambiguous lines between acceptable and unacceptable behavior. When is something jargon or a fun joke, and when does it turn into sexual harassment? And sometimes there were also disputes over how to interpret the act. So there are competing interpretations over how the same incident should be interpreted and understood. So competing conceptual frameworks that they were struggling with. And that is also one of the reasons why proper information becomes so important, and why that also becomes important for prevention in learning to understanding what it is that is happening.
Yes, if people are educated, they know what to look for, I think that means. So what are your there's a lot of data. What would be your future plans with these data, or with this study subject?
Did you say anything about the data from?
No, the data from in the Arenas article is from Germany and Sweden. So 12 students from Sweden and 15 from Germany. So 27. Yeah.
Yes. Thank you.
And I just want to say, also the benefits of the COST network is that we are so many people here, and we can design a shared study. So we have designed the interview guide, and we have translated it to different countries, and we have transcriptions from the interviews that we have transcribed it back again to English. So this is a way of working that we are doing during 2 years. And we have been regularly meetings online. And we have also been on a writing seminar in Croatia. And we have been participating on International Women's Day. And when we had a digital seminar. And we have been, also plans for conferences presenting these results. But also we are going to talk about future plans, both with the data, the big, huge amount of qualitative data, and also how to work and collaborate with other groups that are implementing new models and methods for prevention and supporting of victims of sexual harassment. So we are going to be the research part of that. So we have big benefits of working like this.
Yes, also here the network, the European Sexual Medicine Network, comes to be a big advantage to work together with many countries within Europe, I'd say.
Yes.
I'm curious to find out, it's just my own curiosity, did victim blaming, was that a topic within the studies? Came it up as a topic within the studies?
Well, we didn't put it exactly as a question in the interview guide, but it did come up in some interviews. For example, I can speak for Croatia, as I conducted the Croatian interviews. People did mention it throughout the conversation, but no, it wasn't a special question in the interview guide.
I think there's a lot still to be investigated in this topic. So if you have, maybe one of you has something to add still.
Yeah, I think the way it comes up in the in the prevention articles also as a potential obstacle for reporting, where they are, so to speak, fearful of being blamed when they report, so that there's like an added aspect that it really poses the risk of being subjected to victim blaming. It poses like this obstacle for reporting.
Yes.
Rather than seeing like a lot of victim blaming in the interviews, rather we would say it was quite the opposite way around, where people emphasize the need to place the blame where it actually belongs instead. Yeah.
Yeah, but I think it was not really a topic in the topic list, but it also came up in the concept paper, where the blurred lines also are related to victim blaming, that people were in a situation where they, well, had to figure out if it was sexual harassment or not, and therefore they didn't act. And looking back afterwards, they thought, well, it was harassment, I should have done something. And then they blame themselves for not acting. So also the blurred lines in defining sexual harassment is also related to victim blaming, I think.
If we should say something about why it's so important to meet and analyze the data, because we have met now physically a couple of times, and it has been very important when you have qualitative data. Do you want to add something, Melina, about that?
Yeah, I think it really enriches the process of coding and then analyzing the results, because it's like very important for, especially for qualitative studies, to get to know each other, to like learn how you think, how you like your perspective on things, especially because we're such an interdisciplinary group. So yeah, I think that it's really benefited the process a lot.
And I would also like to say that Cynthia is an example of also a person who wrote your master thesis. You can just say something.
Yeah, I had the opportunity to meet them and do my thesis about the same, but then in Belgium. And I think it's motivated me more to do research about it. So it's very exciting.
Yeah, I would also say to point in or tie into like the coding aspect. When we do qualitative research, we can't really just have somebody making a code guide and say, code it like this. Because for each of those code, there is an added layer of interpretation in the coder. And that is where the physical meetings have played a very important part, like Melina says, for us to understand each other in like making sure that we interpret the codes the same way, so that like what looks like something for somebody, like from a different discipline, they might interpret that code differently. So we need to make sure that we view these codes in the exact same way to make sure that we are actually looking at the same things in our data when we are coding. So methodologically, been very important.
You are probably using thematic analysis?
Yeah.
Yes.
Yeah, so a certain amount of subjectivity is allowed, but I'd say, but it's in the discussions that you get to the bottom of it, maybe.
And in that way, you can also say that you confirm the interpretation of the quotes, because you are discussing it so much and you really get deep into the qualitative research. And
So
I actually use the last version of Brown and Clark, and it's called reflexive thematic analysis. And that's what we have been doing, being very reflexive and very good, digging deep into the data.
I think it's also very important then to meet face to face. I can imagine. I'm into reflective thematic analysis myself also, but it's good you have the opportunity to within the network to be able to meet each other and to discuss this, I'd say. Would you have anything to add yet still?
I just want to say that we're grateful for the COST European Sexual Medicine Network, that we got this opportunity to work together, and also have the support for the on-site meeting, as well as we have met online. So thank you very much.
Okay, thank you all.